cloud. Yes. Thank you. Now I'll hand over to you to the hostship. You lead us now.
Perfect. Thank you.
Too.
I've got it. Lovely. Thank you. Hello, everyone. It's lovely to see so many people. It's great. I'm just going to put my presentation up now. Now I've got hostship, so bear with me 1 second. Okay. Right, there we go. Okay. So this morning I'm going to tell you about the speech and language therapist role with children with autism. There are lots and lots of things that speech and language therapists do, which you may not be aware of. We do a lot more than just working with speech. So I'm just going to run through that, and then a couple of extra areas that are really interesting as well that you might want to know about. So what do speech and language therapists do? Well, we work in lots of areas. We work with speech. That kind of makes sense. Language, social skills, eating, drinking and swallowing, and communication. And I'm going to explain all of these so you can see the things that are involved in them. So if we think about communication, first of all, we think about very early communication skills, which are very useful. Bear with me, I have to keep pressing a few buttons because I can see more people arriving. There we go. Sorry. Okay, so foundation skills are really important, and speech and language therapists work a lot on these. These are the skills that you need even before you speak to be able to communicate. So we're thinking about things like understanding cause and effect. So the understanding that if I do something, it affects you. And that's exactly what communication is. I say something and I want you to respond. So we teach cause and effect to children. We can teach it without using speech, and then we can move it on to speech. We want to learn about listening and sound discrimination, because in order to communicate, you need to be able to listen, and you need to be able to discriminate a speech sound from all the other sounds that are going on around in the world. So you need to be able to hone in on someone talking to actually understand what they're saying. So we teach listening and speech discrimination. We teach attention. Attention is really important in communication. You have to pay attention to understand what someone is telling you, and you have to give your attention to be able to then reply. So we do giving and getting attention in an appropriate way. We work on looking and eye contact. Again, in order to communicate, you've got to look at the person, and you've got to understand that if someone is looking at you, they're probably going to tell you something, so you'll get ready for that. We work on motor imitation. Now, motor imitation just means movement imitation. We learn a lot by copying, and we learn a lot about speech and communication by copying. So if you can copy someone successfully, you can learn. So movement imitation is about copying the movements someone makes, copying clapping hands, copying making kiss shapes. We do this with children, we do this with babies. We say, oh, clap hands and copy me. So we teach that copying and turn-taking skill. And then we can move that to verbal imitation, which is just copying speech sounds. So then we start saying, oh, can you say mum, mum, mum? And hopefully the child will copy you. But we can teach this as a skill for children with autism as well. Turn-taking is a really important skill for communication, because in order to communicate, you need to learn that you say something, someone else says something. You say something, someone else says something. So we take turns in communication. So we can teach that by copying, you clap, I clap. And we can teach that with lots of other ways so that children learn they have to take turns. And then we start to work on vocalization and speech production. Vocalization just means making sounds that aren't speech sounds, so other sounds that you make with your mouth, with your voice. And then speech production is about specifically making speech sounds. And we're going to look at that in a minute when I talk about speech. So you can see that before we even start on speech and language, we have lots to work on with children. Now, in a neurotypical child, they learn all this without having to have it taught to them. It's amazing how children learn all these skills. But for children with autism, we might need to teach some of these skills specifically because they don't always learn them automatically. So lots of things to work on there. Looking at communication. Oh, why is that not working? Oh, there we go. Sorry. Looking at communication. So communication is about how we use our speech and language and the associated skills to communicate our needs, our feelings, and our choices. And if you can't use spoken language to communicate, there are lots of other ways that we can teach for communication. So communication is a very general term for how we interact with other people. Excuse me, I'm keeping on pressing buttons because I've got new people coming into the meeting, so I'm just dropping them in. So we'd like to teach people to speak, but if we can't, we can use sign language. Now, we often use a sign language called Makaton in the UK. It's a simple sign language, and it means we can work really quickly and easily. We haven't got to teach a complicated sign language like British Sign Language, which is very complicated. We can make adaptations for other languages as well. So if we want to adapt speech, sign language to Somali, we can look at how that is adapted, because Makaton is really suited to all sorts of other languages as well. We can use communication aids. So this is something, a computer, a phone, a tablet, where someone can press buttons on that to say what they want to say. And there are lots of different systems that can be used to help people communicate. We can use something called PECS. Now, this stands for Picture Exchange Communication System. And it helps a child who can't speak to take a picture, hand it over to someone to communicate a message. And we can teach that in lots of different little stages. It's a really useful communication aid. We can use objects of reference. So these are real objects. So you can hand an object to someone to say, I want something. So for example, if I want to ask for a drink, I've got a drink bottle here. I could hand this to someone to say, fill it up, I want a drink. Or I could hand it to someone to say, do you want a drink? So we can use a real object to help someone communicate their needs. And then we can use symbols, pictures, or photos to point to show to someone, to help them to understand and help them communicate. And we often use the symbols, the pictures, and the photos with a communication aid or with another system as well. So speech is great, but there are lots of other things we can work on if a child can't speak. And very often we'll use one of these systems with speech as well. So you've got options, you've got different things you can use. It's not always just about using one thing. So that's communication. That's that real general umbrella of communication. Now, obviously, we want to try and work on speech. Speech is the production of sounds and words. So there are lots of things we can do to work on teaching speech. A common term that you may hear is dyspraxia or apraxia. So this is a diagnosis that a child might get from a speech and language therapist. And it means they have a difficulty with producing the planned and coordinated movements needed for speech. So in order to speak, we need to make a plan in our brain for what we're going to do to make that speech sound. So if I want to make a B sound, my brain has got to figure this out. The brain has then got to send the messages to your muscles of your mouth and tell them you need to put your lips together, you need to breathe at the right time, you need to make some voice at the right time, so some noise, and then you need to put all of that together to make a B sound. Then if you want to say a word like ball, you then need to add other sounds on in the right order. So coordinating that is very difficult, and a lot of children with autism have this difficulty called dyspraxia or apraxia. Which means they have difficulty in planning and coordinating those movements. So this is something a speech therapist can work on, and we can do lots of things to help a child with this diagnosis to be able to speak more clearly or more easily. There are other difficulties children experience with producing speech, and a speech therapist can do an assessment and figure out where the difficulties are, and work with the child or provide you with ideas to help you help your child. So that's speech. Speech is just about the sounds and the words, the little bits. And then language is about the amount of information that you're able to understand and use. And it might be spoken information, or it might be written information for reading and writing. So language is bigger than speech. It's how we use speech to communicate. Language includes vocabulary and grammar. So building a vocabulary, learning the different words for different things. Grammar, learning how to put those words together to make a sentence that makes sense. And obviously, if we're working with a child who is bilingual or is working in 2 different languages, there will be different vocabulary and grammar for both of those languages. So that does make it more difficult, but it does mean we can still work with that. And when you're looking at language, there are 2 sides to language. One is comprehension. So that's understanding what other people are saying to you. And then the other side is expression, which is you speaking, you using language, you expressing yourself. So people can have a difficulty with both sides of this or just one side. So again, a speech therapist can assess the child's difficulties and pinpoint exactly where the child is having difficulties and what we're going to do to help them. So there's lots and lots going on there with speech, with language, and with communication. Those are maybe the obvious areas of speech and language therapy that people think about. We work on speech, we work on language. But there are other areas of speech and language therapy that the speech language therapist can help with as well. Social skills is a really, really important area. This is particularly important for children with autism, and we often find that children with autism, they struggle with social skills. Social skills is how someone uses their speech, their language, and their communication in an appropriate way. So some examples of social skills. Starting conversation. So how do you start a conversation? How do you make someone know you want to speak to them? You might go up to someone and poke them. That does get someone's attention, but it's not an appropriate, a good social skill. So we want to teach children a good way to start a communication rather than a not a good way. We want to teach children the appropriateness of what you say and how and who you say it to. So you might talk to your friends in school differently to how you talk to your parents. And you might talk to your parents differently to how you talk to your teachers. So learning what's appropriate in different situations is very important. Social skills involve making eye contact with people, actually looking at the person you're speaking to, and expecting them to look back to you. Now, this can be quite difficult for children with autism, so it's an area we can work on, that eye contact, which tells someone, I'm looking at you and I'm listening to you. We mentioned turn taking before. Working on turn taking in communication is a really important social skill. If you keep saying things when other people keep saying things, you can't have a conversation. You just interrupt each other all the time. So taking turns is a really important social skill to make communication work. And keeping on topic. Now, this is a really good one for children with autism. They tend to have their favourite topics that they talk about and they want to talk about, and they often don't want to move off those topics. So actually keeping on the topic of the conversation rather than your favourite topic is a really important skill to learn. And that's something we can teach to children who have maybe higher level skills. They're talking, they're communicating, but their social skills need a little bit of help. And then repairing communication breakdown. Now, this sounds complicated, but actually it's really straightforward. This is just, what do you do if something goes wrong in communication? So if I ask someone a question and they don't answer me, what do I do? Do I just walk away? Do I say the question again? Do I say it in the same way? Do I say it in a different way? Do I poke them? Do I shout at them? So appropriate ways to make things right when things have gone wrong are a really important skill, because things do go wrong in communication quite often. People say the wrong thing, they don't hear what you've said, So it's a really good skill to learn how to make that right again, rather than just giving up and walking away or getting really cross and shouting and screaming. So that's another good social skill. There are lots of other social skills. I've just picked out a few key ones here. And social skills are a really important skill to have so that you can communicate effectively with lots of other people. Not having good social skills can mark children with autism out in schools. And this is one of the things that unfortunately make other kids go, oh, you're a bit strange, I don't want to talk to you. So having good social skills is a really important skill so that you can integrate, you can get on with other people and take part in communication. The next area I'm going to look at is eating, drinking and swallowing. So sometimes a lot of people don't realise that speech and language therapists actually have lots of skills in helping people to eat, to drink and to swallow. Now, there are a number of reasons why people might have difficulty with eating, drinking and swallowing. The first reason is called dysphagia. Now, dysphagia just means a problem with eating, drinking and swallowing. This might include managing food in your mouth. So if I put something really crunchy in my mouth, can I chew it? Can I make it into a soft enough food to swallow? And then actually swallowing that food as well. Some people with autism have difficulties with chewing food, with moving food around in their mouth. Sometimes they have difficulties with swallowing food, but more it is often about that actually making the food work in your mouth. We often see children with autism who will take a mouthful of drink and then hold it in their mouth and smush it around and then dribble it back out again. So working on how to actually take the drink in your mouth and swallow it properly is a really helpful skill. So there are lots of things we can do there to help with eating and drinking. The other problem, which is possibly more common in children with autism, is what we call fussy eating or food refusal, or picky eating sometimes it's called. So this is when there's a problem with what the person chooses to eat rather than how they eat and swallow. So things that are a favourite, there's no problem. They go in their mouth, they chew them, they eat them, they swallow them. It's not a problem. But often these children have very, very limited food choices. They will only eat very soft things, or they will only eat chips and burgers. They will not eat any fruit or vegetables. So this is something we can work on. There is often a reason why children are choosing to be very picky with their eating. It's not that they're just being a pain. They have genuine reasons why they choose not to eat certain foods. And if you look at the next point down, the problems with eating and drinking may be due to a physical reason. So they can't actually make their mouth work for the food. It may be a behavioural reason. They've learned that something is nasty in their mouth, though they're not going to eat it again. Or it may be a sensory reason. Now, a sensory reason means that things don't feel right in their mouth. So they might not like the feeling of broccoli. They might not like the feeling of rice in their mouth. So they choose not to eat it. Or it may be a combination of all these things that is causing someone difficulties with eating. So a speech therapist can have a look at the problems with eating and drinking and figure out what exactly is the problem and how we can tackle this. It can be a difficult area to deal with, particularly if it's behavioural, that a child has behavioural problems around food, because there's a lot of work there to undo the behavioural problems. But it's certainly an area we can work on. And a little note there at the bottom, saliva control comes into this area. So children who dribble, children who play with their saliva, things like that, children who choke on their saliva, we can look at that in this area as well and help children to be able to swallow their saliva efficiently and not dribble the saliva out onto their chin. So that's another interesting area for speech and language therapy that you may not have known about. Those are my key areas that speech and language therapists work with. And most speech and language therapists know a little bit about all of these areas, but you may need a specialist to look at some of these particular areas. Speech and language therapists have different areas of specialism that they work on. So sometimes you will need to seek out a specialist for certain things. I've got a few notes about other things that you might be interested to hear about. Now, these are specialist areas that only a few speech and language therapists work with, but there are other specialists that look at these things as well. So I'm going to talk about sensory processing. Now, traditionally, this is something that an occupational therapist has expertise in and can work with. But we have got a few speech and language therapists that have got this training and this expertise as well, because it actually fits very well in with speech and language therapy. So, sensory processing difficulties. Many children with autistic spectrum conditions experience sensory-based difficulties. So, a sensory difficulty means that you have difficulties in responding to the stimulation coming in from the world around you. So this might be things you hear, things you see, things that you feel on your body, where your body is in the room, in space. It may be confusing, all of these sounds and feelings and sights that are coming into you. And it may also mean that you have difficulty responding appropriately to all these stimulations that are coming in. So for example, if I touch my arm, I know that that's not going to hurt me, so I can respond appropriately by just keeping my arm there and then moving it away. However, for someone with sensory difficulties, that gentle touch may feel really horrible and they may want to pull their arm away really fast or run away. Or they might not feel that at all, so they might not even know you're touching their arm and just like move through you. So there are lots of difficulties with sensation that can cause problems with behavior, with communication, with being near someone, with moving around in your environment. So you can see that sensory difficulties might affect your ability to direct and maintain attention. If everything's too loud, then you're not going to want to stay and pay attention to something. If all the lights are too bright in your eyes, you're not going to want to look at something. So there are lots of reasons why sensory difficulties will affect your attention. Sensory difficulties affect your ability to regulate your behaviours. So if everything that touches your skin feels really horrible, you're not going to stay and behave yourself. You're going to want to move away, to jump away, to push away. So very often those behaviours that we see with children with autism, they actually have a foundation in sensory processing, in how things feel to us. Sensory difficulties affect your ability to produce speech. In order to make sounds, we need to feel what's going on in our mouths. So, for example, to make that B sound, I need to feel that my lips touch each other and then they open like that. And if I can't feel that, then it's going to be difficult to make that sound. I might keep my mouth open because I don't know, my lips aren't closed, and go, and I'm not making a sound. I might squish my lips together too hard like this. And I can make a sound, but it doesn't sound right and it's hard work. So that feeling of what's going on in my mouth is really important for speech. And it's the same for drinking. If I can't feel what's going on in my mouth, then it's really difficult for me to eat and drink properly because I can't feel the food or drink in my mouth. Can I just remind everyone to mute, please? Because I've got something going on in the background. I think I can see what it is. I'm just going to pop you on mute. There we go. Sorry to put you on mute forcibly, but it's interfering with everything else. Okay, so sensory processing difficulties affect our ability to eat and drink. If we can't feel food and drink in our mouths, then it's going to be really difficult to actually eat it correctly. So this is a really interesting area for children with autism, and I'm hoping that some of you who are following this, you're already thinking, oh gosh, that's something that I think might be affecting my child. So an occupational therapist can help with this, and some speech and language therapists can help with this as well. So that's sensory processing. And then we have something else to talk about as well. This is called applied behavioural analysis, or ABA. So you may have heard of this as a technique to work with children with autism. This is a really helpful technique that we can use to help children with autism to learn. So it's about teaching children with autism. You can often use this as a home-based approach to behaviour and learning. It can be used in schools as well. Some schools specialise in using ABA techniques to help with learning. It's a very old technique that can be used to teach people to pay attention, to respond appropriately, to wait, to look, to listen, and to interact. We can teach copying. We can teach copying of movements, of speech. We can help children to wait, to know what's coming next. All of this through ABA. It's a really complicated area, and you do need someone who is a specialist in using ABA. There are some speech therapists who are trained in using ABA, but very often you need somebody who's called a BCBA, so someone who is trained to a degree level to use these techniques. And there are lots of companies out there that use this, and they can come and work with your child, give you advice as well. The reason I've included this is because it works really well with speech and language therapy, because it provides a really structured approach to learning. So we can teach everything we need to teach in speech and language therapy using an ABA approach. It's very, very helpful. Sorry, I'm just admitting someone else. There we go. And one of the other key things about ABA is it will help parents to know how to respond to your children's behaviours. So if you have got a child who is doing things that you're not sure how to respond to them, they're screaming, they're shouting, they're punching people, they're running away, it can be difficult to know how to respond to that for the best. And ABA can teach you how to respond to that behaviour so that you can then reduce the behaviour and turn it into a behaviour that you want. So that is one of the really important things. It helps you to manage your child's behaviours and make it much easier to teach your child and help them to learn. So that's applied behavioural analysis, or ABA. There is lots on the internet about this, but it's something that if you want to find out more, I'd be very happy to direct you to some ABA teams who can help you, or you can use the internet to find them. So that's a very, very quick view of what speech and language therapists do, some areas that you might not have thought about that you would like to help your child to learn in, and also a few things, sensory processing and ABA, which aren't speech and language therapy particularly, but really work well with speech and language therapy to help a child with autism to learn and to integrate and to communicate. I've just got a couple of other slides to tell you a little bit about speech and language therapy. And then I'm going to hand over for questions and translation as well. So, speech and language therapy. Now, in the UK, speech and language therapy is available through the NHS. If your child's attending school or a special school, then you should be able to get speech and language therapy help through your child's school. If they're not at school, if they're homeschooled, or if they're too young to go to school, there should be an NHS service to help you with your child. Now, the NHS services are very limited in what they can provide because they're very, very busy. And you may not be able to get specialist support from the NHS or, because they may not have those specialists in your area. So do look towards your child's school and the NHS services first for help with speech and language therapy. But if you want to look for a private and independent speech and language therapist, there are a few things here, a kind of checklist that you can go through to make sure that you've got someone who's actually a proper private speech and language therapist. So an independent speech and language therapist, or in fact any speech and language therapist, should be registered with a body called the RCSLT. Now that stands for the Royal College of Speech and Language Therapists, and all speech therapists should be registered with them. They should also be registered with HCPC. Now, HCPC stands for the Health and Care Professions Council. And in the UK, it is a legal requirement that all speech and language therapists who are working have HCPC registration. This makes sure we're actually doing what we're meant to do. So that's a really important one to ask. Is your speech therapist HCPC registered? HCPC have a website, and you can check everyone on there as well to make sure they're registered. A few other questions you might want to ask. Does your speech language therapist have basic training in child protection or safeguarding of vulnerable adults? This is really important because it means they know what to do if there is a problem with a child. They know how to deal with that, and they know who is the right person to tell if they have a concern. Are they DBS checked? So DBS stands for Data and Barring Services. And this means your speech therapist has been checked to make sure they don't have a criminal record and that they are legally okay to work with children. So that's an important one. You'd also might want to check if they have professional indemnity and public liability cover. So are they actually insured? So if there's an accident, do they have insurance to cover that? Something that's important, obviously, if you're going for independent speech and language therapy, you will have to pay for this. So make sure they provide clear upfront information about how much you're going to have to pay. The speech therapist shouldn't keep it a secret. You should know what you're going to have to pay. They should be very honest about this so that you don't get a bill for more than you were expecting after your speech therapy. So expect them to be able to tell you how much it's going to cost. They may not be able to tell you how long your child is going to need speech therapy for, but they should be able to tell you how much each session is going to cost so you know moving forward what you're looking at. You might want to ask them how many years of experience they have. Speech therapists obviously have to train at a university, and then when they finish training, they can start work straight away, but they may not have a lot of experience at that point. And then we have speech therapists who've been working for 20, 30, 40 years. So they have a huge amount of experience. Now, you may want to ask what experience they have to give you an idea of whether they've got a lot of experience in working with children with autism. And you may want to ask them if they have specialist skills. For example, specialist skills in working with children with autism, using ABA techniques, working with children with dyspraxia, sensory processing, food refusal and picky eating, all those things we've just talked about. You might want to have a specialist in those areas. So those are things to look for when you're choosing an independent speech and language therapist, but they're actually questions you can ask an NHS therapist as well, because we all work to the same standards and qualifications. I have just included this slide about my company, because I work with a team of speech and language therapists in an independent practice. The independent practice is called EG Training, and we're based between the East and the West Midlands, so between sort of Leicester and Birmingham, and we provide services across the Midlands. We've been going for quite a long time, over 20 years, and there's the postcode there for where we're based. We provide services across the UK and also locally. And we have a large team of staff, including speech and language therapists and therapy support and admin staff. So we've got lots of different ways we can work. We have a team of therapists who have lots of different skills. We have some new therapists who've only just been qualified. And then we have therapists with 25, 30 years experience as well. And we work with children and adults with lots of different diagnoses. So we work with children and adults with autism, but we also work with children and adults who don't have autism, but have other difficulties with communication. So we're one independent speech and language therapy practice in the Midlands. There are others, of course, and you can find them on the internet. So you can make sure you get the right person for your needs. Okay. And I will pop up on the screen there. That's our contact details, and we have a website in case you want those there. So I have covered really quickly lots of areas about speech and language therapy. I can see there's a couple of things on chat, and we will also go back for translation and questions now as well, because I'm really happy to answer any of your questions. So I will stop the screen share for now. I'm just going to have a quick look at the chat. Right, I can see someone's asked if they can have the presentation. So Samir, I think that you've already got that. I'll check in with that.
It was me, don't worry.
Oh, okay.
Thank you. if you hand over to me the hosting, and we can continue from here for the questions, I will be happy. And in the meantime, I'd like to thank Helen for giving her time and explaining to us parents about speech and therapy, because one of the things that the parents of autistic children have most is to deal with loads of professionals, and unless you know who's doing what, you cannot navigate that. And the reason we chose you is because of your qualifications, your personality, and you are giving this much time and dedication to the humanity. And I couldn't thank you enough for that, because I know how busy you are, your schedule. So without further ado, I would like to welcome